which symbolizes the science of nursing and each candidate's commitment to providing quality, safe, compassionate, patient-centered care. This white coat also symbolizes a transformation that is about to happen to each and every candidate. Starting tonight, the white coat will represent each of them as a healthcare professional and signal their transition into professional nursing. Candidates, you represent nursing, and you represent SUNY Downstate College of Nursing. At this time, I would like to invite Dr. Nellie Bailey, the College of Nursing's Associate Dean for Undergraduate Programs, to the stage.
Good evening, everyone. Good evening, everyone.
Good evening.
Thank you, that's good. This is a wonderful and special occasion, especially for the students, the class of 2016. So for those of you who are here for the first time, we'd like to extend a welcome to you, and we hope that this will not be your last time, because there are many activities that will be produced for the students. We'd like to thank you so much for coming out this evening to share this special occasion, because it's extremely special. And it means a lot to us as a college and a lot to the students. So on behalf of the Dean and faculty of the College of Nursing, and for all of our adjunct faculty, we welcome you this evening.
Thank you, Dr. Bailey. It is now my pleasure to present to you the Dean of the College of Nursing, Dr. Daisy Cruz Richmond.
Good evening. Good evening. Thank you all for joining us tonight's second annual College of Nursing White Coat Ceremony. I bring greetings on behalf of SUNY Senior Leadership President Williams and his cabinet, and I am so pleased that we have Associate Vice President Dorothy Fife with us today. And on behalf of the faculty, staff, and other students in the College of Nursing, I welcome you all. While the White Coat Ceremony is a tradition and a ritual for medical students, for nursing students, it is a new tradition. Just to give you a little history, last year, the American Association Colleges of Nursing, for short AACN, in collaboration with Arnold Gold Foundation, launched the first inaugural White Coat Ceremony for nursing students. It is a recognition that compassionate care, humanistic care, is not the only domain of medicine. It is for all healthcare providers, including nursing. And nurses are in the healthcare system 24/7. So today is not only the recognition that we are celebrating the White Coat Ceremony, but it is also that in 2014, last year, AACN and Gold Foundation decided to grant awards to 100 nursing schools across the nation. The first 100 included our College of Nursing. And I am pleased that out of over 740 schools of nursing nationwide, we were selected as one of the first 100. So this is our This is our second year, and we will do it annually from this day moving forward. The White Coat Ceremony was originally designed by Gold Foundation to welcome new students, to initiate new students into their professional role with clear expectations, focusing and emphasizing the importance of humanistic care, the importance of compassionate care. For all nurses, compassionate and humanistic care must be the gold standard for clinical nursing practice. It must be the hallmark, the cornerstone when we render patient care, not only to individual patients, but also to their families and to the communities where they reside. So from this day forward, this is not only a celebratory event, but it is symbolic that you are going to provide compassionate care, humanistic care to your patients at all times. Thank you very much and enjoy the evening.
Thank you, Dr. Cruz-Richmond. I'd like to now introduce Dr. Layla Sedholm, Associate Dean for Graduate Programs, who will introduce our keynote speaker.
It gives me great pleasure to introduce to you one of my colleagues, Dr. Shirley Girard. Dr. Girard is the Associate Dean for Research and Innovations and Professor at SUNY Downstate College of Nursing. She holds a PhD in Health and Social Policy from the Heller School, Brandeis University, and a Master of Science in Nursing from Yale University, a Master of Art in Medical Sociology from the University of Connecticut, and a Bachelor of Arts with a major in Sociology from Eastern Connecticut State University. She currently serves on the State of Connecticut's Practice Transformation Task Force, a committee of the CMS initiative to develop state-level healthcare improvement models. Dr. Girard's professional career has included clinical practice in a variety of settings, including work as an advanced practice nurse. Prior to coming to SUNY Downstate, Dr. Girard was Dean of the School of Nursing at Long Island University and Director of the School of Nursing at San Francisco State University. She has held positions in philanthropy, public service, management, and administration in professional organizations, healthcare, and education. Her scholarly work has focused on the nursing workforce, evaluation, public policy, and nursing education through publications, grants, service on several editorial boards, and professional speaking. Serving on national, state, and local committees, Dr. Girard is committed to improving health and healthcare and advancing the profession of nursing. Please join me in welcoming Dr. Shirley Girard.
Welcome. I'm delighted to be here. I'd like to acknowledge Associate Vice President Fife, excuse me, Dean Daisy Cruz-Richmond, my faculty colleagues, distinguished guests, friends, and family. It truly is an honor to be with you on this important occasion. It's an honor not only because you are making a very significant transition, but it's an honor because it allows us an opportunity to remember why we're in this business after all. So this ceremony has great importance to all of us at the College of Nursing. One of the things that's important to remember is that the issue of caring that's being highlighted in this ceremony and the transition to professional nursing practice is not new. Caring has been around in nursing, it's been around in nursing education, and it's been a staple of what we do as nurses. Our nation, you, our world, our health and our health care will be influenced by all of you as the next generation of nursing leaders. So we welcome you, and we want to emphasize the important things that you do and the importance of you as healthcare professionals. I can't see my slides. Okay, that's the theme of today, and that emphasizes the importance of you as leaders. Next slide, please. What I'm going to talk about is the who, what, where, when of nursing and caring. The who. Caring is inherent and a part of all healthcare, and Dean Cruz-Richmond alluded to that. It influences how healthcare is organized, delivered, and financed, and it influences outcomes for everyone, the sick, the well, and those of us who depend on our society. Nursing and caring are always related, so you and all of us who are nurses are the who. Next slide, please. This is a definition of nursing. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, the alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. The challenge I have for you is how could you meet that definition and fulfill the commitments inherent there if you didn't care? Next slide, please. The question that we need to ask ourselves is, what is caring? Everyone's laying claim to caring these days. The patient-centered movement, if you will, in this country talks about caring. When I first found out that this agency was being created, it's called PCORI. Oh my God, patient-centered Organization for Research and Innovation. I think that's what PCORI stands for. I should have rehearsed that part of it. But they said that it was patient-centered. When I heard the presentation at a national meeting, I got up to the microphone and I asked, and I make sure I always introduce myself as a nurse, I asked, where is the patient? Because they were talking about the research that was going to be done, what healthcare providers were going to do, and I said, where's the patient? The good news is that the person who was the head of the Agency for Healthcare Research and Quality, who was hosting that particular symposium, got up and said, oh my God, we hadn't thought about that. She didn't mean it quite that flippantly, but she really did pay attention, and PCORI is actually moving to doing things, to engaging patients. But it's the pressure of nurses, it's the pressure of people who care about the patient and really see them as the center that have helped that to happen. So the next slide, please. Oh, I'm sorry, back one more to the what is, okay. So we all think we know what caring is, but there is a difference between caring as a human being and caring as a professional nurse. They're not mutually exclusive, but certainly they are different. There is a theory, a science, and an art to caring as a nurse. Caring as a focus has had a mixed history in nursing because sometimes we didn't want to be regarded as the nurturing, caring people. But if you go back, and I know you've started studying something about the history of our profession, and you look at Florence Nightingale, she really did embody caring, but she also used her science, her evidence for what was going on with the patients that she served, with the observations she made about the community to make a difference, and that's how she personified her caring. Professional caring moves beyond the emotional or the human response. It requires knowledge and expertise. It requires action. And there is, as I said, a theory in science. It is also the basis of our ethical code of ethics. Next slide. These are the attributes of caring, and I'd like to say a couple of words about each of them, and then I'd like to tell you a story about how they might be operationalized in your practice. The first is compassion, and that's having empathy, being sensitive to human pain and joy, being with another in their suffering. And that really means being with someone. Think about what that means in your day-to-day experiences. Caring also requires competence, and that's acquiring and using evidence-based scientific and humanistic knowledge and skill. It requires that you apply that knowledge and skill in your practice. It asks that you seek help and you seek clarification when you don't know. It means that you always want to know why you're doing what you're doing. And it means that you're continuously learning and acquiring both knowledge and skills. Caring also requires confidence, and that's confidence in yourself, that's confidence in your knowledge and skills, that's confidence in your profession. You exemplify this through consistency in your behavior and having a strong sense of who you are, and I can't emphasize enough the importance of what you are doing. It's not an arrogance, but it's an importance. Caring also requires a conscience, and that's the moral conscience, to do what's right, to do what's honest, to deliver care and follow your own conscience rather than do what you think others want you to do because they want you to do it. It also requires that you represent the needs of your patients and the people that you care for in the community. Caring also requires a commitment, that you're dedicated to the work that you do, that you uphold the strong values of the profession, that you maintain and elevate. Not only do you maintain the standards, but you elevate. That means you make them better, and the obligations of our profession. It also requires, and these are some new additions that I found in preparing today, it requires courage and creativity, and I was particularly interested in that. It requires that you take risks if you really care. It requires that you're an advocate. It requires that you think reflectively, critically, and imaginatively, and that you have a vision not only for your patients, but for health and healthcare. It also requires cultural sensitivity, a sensitivity to the diversity of the world around you, that you work creatively and to create a culture of compassion and a patient-centered environment. And finally, caring requires that you communicate, that you speak out, that you're clear and visionary in what you say, that you both communicate in written and verbal forms, and that you share and engage with your colleagues and your patients in all that you do. The next slide, please. So where do you do this caring? I would say everywhere. When you have spent a little time preparing in your profession, I know I have this experience, I observe things that most normal people don't observe. I make diagnoses on the subway. I see people with all kinds of things, and it's amazing that I'm right. I was doing substitute teaching once. This maybe goes to speak about how my mental health skills and knowledge could be improved, but I was doing substitute teaching well, it's a long story, but anyway, I was doing substitute teaching for $50 a day, and I was assigned to a 4th grade classroom. And there was a little girl in there who was clearly isolated from the other students. Well, breaks my heart, there's my compassion, there's my caring. I tried to work with her, I'm only there for one day, but I did give a report to the teacher, and I talked about how difficult it was for that little girl. And I wanted to know what the school was doing about that. I wouldn't say that the response of the teacher was entirely satisfactory to my nursing perspective, but I was aware of what was going on. So I was not a nurse in that setting, I was the substitute teacher, but my nursing knowledge and skills follow me everywhere, whether I like it or not. But you're going to be doing this in the bedside, at the bedside, in the patient's home, in your own homes, in the community, and I hope in the boardroom, at the State House, and maybe even at the White House. It really is important for us to take our caring and what we do as nurses to society. Next slide. So when does this all happen? When does caring happen? It happens now. It starts now and it never ends. And I hope this is just the beginning. We all continuously improve our knowledge and skills in everything, including our knowledge and skills in caring. It will never end for you as a lifelong learner. You'll always be engaged. Next slide, please. So how do we do this? What do we do? What behaviors should we have as nurses if we are truly caring? And I'll just give you some examples. There's certainly knowledge and skill that we need. That's part of why you're here. It will never stop. There are skills and actions, how you apply that knowledge and what you know. And then there's the attitudes that are necessary to improve quality and safety. That's what this education is about. That's what your life is about. So what do we expect from you? What should you expect from yourself? And what do your patients, most importantly, expect from you? That's attentive listening. That's comfort. It's honesty. It's patience. It's responsible and accountable behavior. It's providing information. It's partnering, truly partnering with the patient. And very few other disciplines really have that same sense, in my experience, of what true partnering means. When I was a nursing student, my very first day of nursing school, they drew a great big circle on the board. This was the old days. And in the middle of it, in the middle of the circle, was the nurse and the patient. And then around that was family, and then there were other members of the healthcare team and the community and all the things you would expect in that circle. And I really believed that that was how the world saw nursing. So I got a little confidence at the beginning. It was later in my life that I found out I still had a little work to do with the rest of the world. But it was there. What we do is very important, and we are truly the partners of the patient, which sometimes can be incredibly challenging. We also demonstrate our caring through knowledge and its application, through respect for the patient and others in the world, and we use our relationship with patients to improve outcomes for them and for society. The next slide, please. So congratulations. You have made a significant and life-altering decision to join the nursing profession. I expect that it will change your lives, certainly, probably your families, and certainly temporarily will change your families' and friends' lives. But most importantly, the lives of your patients, the lives of your communities, the lives of our society and our profession will be changed by your caring. The application and significance of caring in nursing reminds us that caring is the core and the foundation of our practice. Caring is the vehicle through which we interact with patients and assist them, and caring is the action that nurtures and the action that fosters growth and change. Caring is the framework through which we as nurses implement the art and science of professional practice. And let me just close with a story about something that I've done. And you know from that introduction, which I didn't write, so I was a little surprised to hear all those details. I was wondering where they came from. But I have done many interesting things in my life. You as nurses will have that opportunity. But the roots of whatever you do are in your patient care. I use that experience and my continuing interactions with patients as a volunteer to inform what I do. When I sit at the commission or on the task force to transform patient care in the state of Connecticut, I am there as an advocate for nurses and an advocate for patients. We have made some significant inroads because I'm sort of the one that's always raising my hand. And the advocates find their voice through me. We have challenged the weak ethical policy of the state and had that changed. We have challenged the way in which community practice was going to be organized. We have challenged and changed the standards that are being used for advanced medical homes in the state of Connecticut, and that has been the advocates and I getting together, and I was able to take their concerns and their issues, and we were able to provide a united front, and we did have a significant impact. So you can do this. There's nothing unique or special about me. You can do that and really make a difference. You can certainly make a difference in the lives of your patients, but you can make a difference well beyond that. And the story that I'd like to share with you is one from the bedside, and it's a fairly recent one in my practice. I was working in long-term care as a staff nurse. I may be one of the few PhD nurses in the United States that worked in long-term care as a staff nurse, part-time, per diem. I was teaching at the time. But in that setting, we had a great geriatrician who was on our staff there, part-time, not full-time. But I had a lot of knowledge, and I had been teaching research, and I had read this study about NPO, how long patients should be kept NPO. Combining that with my knowledge of geriatrics, when I saw that this patient who is 88 years old, who is going for cataract surgery as an outpatient the next day, they wrote down that she had to be NPO after midnight. And I went, oh, wait a minute, aren't we have problems with dehydration in older people? And gee, she's not gonna have surgery for like almost 24 hours? Why on earth would we make her NPO after midnight? That makes no sense, and there's no need for it. And I knew my research because I had found a study that was done some years ago and a clinical guideline that was put out by Anesthesia Association. So I said to the geriatrician who happened to be there that evening, I said, we can't do this. And she said, I can't counteract the order of the other physician. She said, but why don't you call? You're right, why don't you call? So the physician didn't have the courage, one of the characteristics of caring, that was needed because she didn't want to get in trouble with her colleague. Well, I didn't care about getting in trouble. So I got on the phone and I called the office and and of course somebody says, hi, this is Mary. And I'm like, hi, Mary, this is Shirley Gerard, who are you? And she said she was the nurse in the office. So I said, so-and-so's coming for surgery. We really don't want to make her NPO after midnight because, she's 88 years, she's going to blah, 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 blah. And she said, well, you have to. That's the order. And I said, no, I don't have to. That's what was written down, but we need to have that changed. May I talk? The physician will not change it. I said, you're a registered nurse? She said, yeah. I said, you know what? So am I. And let me tell you about the research that I found, blah, blah, blah. And so I just kept pushing. She didn't want to deal with me at all because she didn't want to have to go to the physician. I said, well, let me talk to him. I'll talk to him, not a problem. So she said, I'll call you back. So she went and she said, okay. So that patient did not have any dehydration. They went through the procedure fine. She was able to eat and drink. For hours, she only had to be NPO a few hours before that procedure. So that's how we embody caring in our practice. We do that all the time. It does take courage. Sometimes it's not always fun to stick your neck out, but the rewards of doing what's right for patients because you care and using your knowledge and skill in your caring is really probably the most rewarding experience you'll ever have in your lives. So I thank you and welcome to the profession.
Thank you, Dr. Gerard. At this time, we will begin the white coat ceremony. The following faculty will serve as cloakers during the ceremony if they would please proceed to the front of the stage. Dr. Veronica Arikian, Dr. Maria Rosario Sim, Dr. Cheryl Zhang, Dr. Margaret Clifton, Dr. Nancy Giordano, Dr. Natalia Chavarost, and Professor Barbara Kitchener. The candidates' names will be called by Professor Joseph Jenis and Dr. Yvonne Nathan. The white coat ceremony is a rite of passage for students beginning their study of nursing. It encourages a psychological contract for professionalism and empathy in the practice of nursing. The event emphasizes the importance of both scientific excellence and compassionate care for the patient. Tonight's ceremony is the result of a collaborative partnership between the Arnold P. Gold Foundation and the American Association of Colleges of Nursing, and is intended to send a message to new nursing students that compassionate care must be a hallmark of your clinical practice. So tonight, as you are cloaked, do not lose sight of the privilege that you are now being given. You are a guest in a patient's life. They are placing their trust and often their lives in your hands. And they, as patients, realize what you might yet not know, that you will be the safety net when all else fails in the healthcare system. The white coat is the cloak of compassion.
Ishaq Abdul. Justin Andrews. Miriam Bogart. Noelle Marie Bowen. Alicia Brown. Noriko Brubeck. Stacy Coles.
Why are they doing that? Oh, walks around.
Look around the side. Go around the side.
Pavel Cruz. Carla Cuenca. Ari Daniels. Jennifer Danielson. Haley Dennett. Allison Denver. Arthur Dvorkin.
Irene Dworin, Lilia Espinosa, Lena Farage, Alexandra Fernandez, Natasha Gavalas, Brian Goff, Talia Groom.
Andrea Johnson, Ray Kim, Magdalena Kozub, Layla Kvorkik, Jay Lackman, Mark Lerner, Rena Lee.
Jake Mathewson, Ilaria Magnotti, Elizabeth Miller, Miriam Mintz, Quarren Nabi, Carrie O. Donahue, Monique Osborne.
Ikra Oza, Julian Palmer, Ramla Paraka, Kathleen Porini, Alexandra Raftel, Justin Riganse, Shani Roa.
Sidros, Saji, Osama
Sidra Sajid, Russell Salzman, Osama Saeed, Kelly Skinner, Kelly Smith, Monica Smith, Janani Taha.
Erica Tong, Janine Vigilante, Stephanie Wong, Zuyan Zheng,
Thank you, faculty. At this time, I would like to introduce the 2016 Student Council President, Osama Syed, who will lead the newly cloaked students in the recitation of the white coat ceremony oath, which is now being projected at the front of the room. Class, please stand. Osama, come and help me.
Good evening, everyone. Everybody's already standing, so I guess we'll get started. As a nurse dedicated to providing the highest quality of care and services, I solemnly pledge I will consider the welfare of humanity and relief of suffering my primary concerns, act in a compassionate and trustworthy manner in all aspects of my care, apply my knowledge, experience, and skills to the best of my ability to ensure optimal outcomes to my patients, exercise sound professional judgment while ethical requirements, accept the lifelong obligation to improve my professional knowledge and competence, promote, advocate for, and strive to protect the health, safety, and rights of my patients. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily with the full realization of the responsibility with which I'm entrusted by the public. That's it. Thank you.
Thank you. Please be seated. Congratulations to the class of 2016 on this momentous occasion. Let's all give them another hand, please. On behalf of the College of Nursing, I would like to thank you all for coming here tonight. I would like to acknowledge particularly Associate VP Dorothy Fife. I'd like to acknowledge some of our clinical faculty and adjunct faculty is in the audience, Dr. Robert Curran, Professor Glenda Martin Grant. And if I missed anyone else, I'm sorry. Thank you all for coming. Thank you for your continued support of the nursing students' academic and professional success. It's been a pleasure to have you all here tonight on this wonderful occasion. I hope you will be able to join us for refreshments outside in the atrium. At this time, I will ask you to remain seated as our faculty leaves the auditorium, followed by the students. So faculty, thank you for coming. Okay, class, stand, and then we can process out.